If you're over 50 and you've been dealing with that strange burning, tingling, or numb sensation running down the front or outer part of your thigh, I want you to know something right now. You're not imagining it, and you're definitely not alone. This is one of the most common yet overlooked issues that affects people in our age group, and today I'm going to share some gentle, practical approaches that may help bring you relief right at home. We'll go step by step, I'll explain everything in simple terms, and I'll give you easier options along the way if you need them. So stay with me, because what we cover today could make a real difference in how you feel. Hello, my friend, and welcome back. I'm Dr. Sarah Truman, and I'm so glad you're here with me today. Before we dive in, I want to be very clear about something important. I'm a health coach and wellness educator. I'm not a medical doctor, and this video is not medical advice. Everything I share today is for general educational purposes only. Please talk to your own doctor or healthcare provider before starting any new exercise, changing your diet, or trying any supplement, especially if you have any health conditions or take medications. Your doctor knows your personal situation best, and nothing I say here replaces their guidance. I want you to think of me as a friend who's done a lot of research and wants to share what I've learned with you, but your physician is always your first resource for anything related to your personal health. Now, let's talk about what's really going on when you feel that burning, tingling, or numb sensation in your thigh. Many people describe it as a hot, prickly feeling on the front or outer part of the upper leg. Sometimes it feels like pins and needles. Other times it's more like a patch of skin that's gone numb or overly sensitive. For some folks, even the light touch of clothing against the skin can feel uncomfortable. This kind of discomfort is often related to a nerve that runs through the hip area and down into the thigh. When this nerve gets compressed or irritated, it can send those strange signals that we experience as burning, tingling, or numbness. Here's what we'll cover today. First, I'll explain why this happens, especially as we get older, and what factors tend to make it worse. Then I'll walk you through 4 gentle approaches that many people find helpful for easing this kind of discomfort. We'll talk about specific stretches and positions that may take pressure off the affected area. We'll explore some simple lifestyle adjustments that can make a big difference. I'll share some common mistakes and myths that might actually be making things worse. And finally, I'll tell you exactly when it's important to see a doctor. Because while home approaches help many people, some situations really do need professional attention. So let's start by understanding what's actually happening in your body. As we age, several changes occur that can contribute to nerve discomfort in the thigh area. One of the most common causes involves compression of a sensory nerve that travels from the spine through the hip region and down to the thigh. Think of this nerve like a garden hose. When everything is flowing freely, water moves through without any problem. But if someone steps on the hose or it gets kinked, the flow gets disrupted. Similarly, when this nerve gets pinched or compressed, the signals it sends to your brain get scrambled, and that's when you feel those burning, tingling, or numb sensations. Now, what causes this compression? Several factors come into play, and many of them become more common as we get into our 50s, 60s, 70s, and beyond. Weight changes can be a factor, as extra tissue in the abdominal area can put pressure on the nerve. Posture changes matter too. Many of us tend to stand or sit in ways that gradually shift how our pelvis is positioned, and this can affect the nerve pathway. Tight muscles in the hip and groin area are another common contributor. When muscles become chronically tense, they can squeeze the nerve against the bony structures it passes through. Even something as simple as wearing tight belts or snug waistbands regularly can contribute to this issue over time. The good news is that this is very common, and you're certainly not alone in experiencing it. Many people find that with some simple adjustments and gentle stretches, the discomfort can ease significantly. It's not about dramatic interventions or difficult exercises. Often, it's the small, consistent changes that make the biggest difference. So let's get into those now. The first approach I want to share with you involves gentle stretching of the hip flexor muscles. These are the muscles at the front of your hip that help you lift your knee toward your chest. When these muscles get tight, and they often do, especially if we sit a lot during the day, they can pull on the structures in the hip area and contribute to nerve compression. By gently lengthening these muscles, we may be able to create more space for the nerve and reduce that burning sensation. Here's a simple way to do this that's safe and accessible for most people. You'll want to have a sturdy chair nearby for balance. Stand facing the back of the chair and hold onto it with both hands. Take a step back with one foot, keeping that back leg straight and your front knee slightly bent. Now, very gently, allow your hips to shift forward just an inch or two. You should feel a mild stretch at the front of your hip on the side of the back leg. The key word here is gentle. We're not trying to force anything, just a mild stretch that you can hold comfortably while breathing normally. Hold this position for about 20 to 30 seconds, breathing slowly and steadily. Then switch legs and repeat on the other side. If standing is difficult for you, there's a seated version you can try. Sit at the edge of a sturdy chair and let one leg slide back so your foot is behind you, with the top of your foot resting on the floor. Keep your body upright and gently shift your weight forward until you feel a mild stretch at the front of your hip. Again, hold for 20 to 30 seconds, then switch sides. A few important safety notes here. If you have hip replacements or have been told by your doctor to avoid certain hip movements, please skip this stretch or ask your physical therapist for a modified version that's safe for your situation. If you feel any sharp pain, numbness shooting down your leg, or increased burning, stop immediately. This stretch should feel like a gentle release, not discomfort. And please, always keep that chair or wall nearby for balance. There's no need to risk a fall. I encourage you to try this stretch 2 to 3 times a day if it feels good. Many people notice that doing it in the morning, after sitting for a while, and before bed seems to help the most. But start with once a day and see how your body responds. Take your time. There's no rush. Even a small effort counts, and your body will thank you for the attention. Now let's move on to something else that can help. The second approach focuses on releasing tension in the muscles on the outer hip and side of the thigh. These muscles can also contribute to nerve irritation when they become tight and overworked. One of the gentlest ways to address this is through a simple side-lying stretch that you can do on your bed or on a padded surface on the floor. Here's how it works. Lie down on your side, on the side that's not bothering you. So if your right thigh is the one with the burning sensation, lie on your left side. Bend both knees slightly for comfort. Now take your top leg, that's the one that's been bothering you, and gently let it drop backward behind you, keeping the knee bent. You're essentially letting the leg roll back while your upper body stays facing forward. This creates a gentle rotation through the hip that can help release some of the muscles that might be contributing to nerve compression. Let gravity do the work here. Don't force the leg to drop farther than it naturally wants to go. Just let it rest in a comfortable position and breathe slowly. You might feel a gentle stretch through the front of your hip or along the outer thigh. Hold this position for about 30 to 60 seconds, then slowly bring your leg back to the starting position. If lying on your side is uncomfortable, you can achieve a similar effect while lying on your back. Lie flat with both knees bent and feet on the bed or floor. Slowly let both knees drop to one side, keeping your shoulders flat on the surface. Let them drop just a few inches, or as far as is comfortable. This gentle rotation can help release tension in the hip and outer thigh area. For safety, if you have any spinal conditions, recent surgery, or have been told to avoid twisting movements, please skip this one or consult with your doctor first. Move slowly and mindfully. If anything feels wrong, trust your instincts and stop. You know your body better than anyone. Many people find that doing this gentle stretch in the evening helps them sleep more comfortably, as the muscles have a chance to relax after being active all day. But feel free to do it whenever it feels good for you. Consistency matters more than perfect timing. Here's another thing that often helps. The third approach is about addressing how we sit during the day, because our sitting habits can play a huge role in whether this kind of nerve discomfort gets better or worse. Think about how much time you spend sitting each day. For many of us, it adds up to hours upon hours. And while sitting might seem harmless, the position we sit in can either take pressure off the nerve or add to it. Here's what tends to help. First, try to avoid sitting for very long stretches without a break. Even just standing up for a minute or two every 30 to 45 minutes can make a difference. Set a gentle reminder if it helps. When you stand up, take a moment to let your hips extend fully. Don't just pop up and sit right back down. Stand tall, let your pelvis shift back to a neutral position, and maybe take a few slow steps before sitting again. Second, pay attention to what you're sitting on. Very soft, sinking couches and chairs can actually contribute to more compression in the hip area because they let your pelvis tilt in ways that narrow the space where the nerve travels. Firmer seating surfaces often work better. If your favorite chair is quite soft, you might try placing a firm cushion on the seat to give yourself a bit more support. Third, check your waistband. This might sound surprising, but tight belts, snug pants, and restrictive waistbands can directly compress the nerve as it passes through the hip region. If you've been wearing tight clothing around your midsection, try loosening your belt a notch or two, or switching to pants with a more relaxed waist. Many people are amazed at how much this simple change can help. Fourth, notice how you cross your legs. If you habitually cross one leg over the other while sitting, this can change the angle of your pelvis and potentially increase pressure on the nerve. Try to keep both feet flat on the floor when possible, or if you do cross your legs, switch sides regularly and try not to maintain the position for too long. These adjustments might seem small, but they add up over the course of a day. And because this kind of nerve discomfort is often related to cumulative pressure and posture, small improvements in how you sit can translate into noticeable relief over time. Be patient with yourself as you build these new habits. Change doesn't happen overnight, but every step in the right direction counts. Okay. This next one is really important. The fourth approach involves strengthening and stabilizing the core and hip muscles in a gentle, safe way. Now, I know the word exercise can feel intimidating, especially if you're dealing with discomfort. But what I'm talking about here isn't intense or strenuous. It's about gently waking up the muscles that support your pelvis and spine, which can help maintain better alignment and take pressure off the nerve over time. One of the simplest exercises for this is what I call a gentle bridge. Here's how to do it. Lie on your back on a firm surface, like a yoga mat on the floor or a firm mattress. Bend your knees so your feet are flat on the surface, about hip-width apart. Let your arms rest by your sides. Now, very slowly, press through your heels and lift your hips just a few inches off the surface. You're not trying to create a high arch. Just a gentle lift that engages the muscles of your buttocks and the back of your thighs. Hold this position for about 5 seconds, breathing normally, then slowly lower back down. Start with just 5 repetitions and see how you feel. If it's comfortable, you can gradually work up to 10 or 15 repetitions over time. The key is to move slowly and mindfully. If you feel any discomfort in your lower back, don't lift as high or skip this exercise and try something else. Another gentle exercise that can help is a simple standing hip extension. Hold onto the back of a chair for balance. Standing tall, slowly extend one leg straight behind you, keeping your knee straight and your toe pointing down toward the floor. You don't need to lift the leg very high. Even a few inches off the ground is enough to activate the muscles of the buttock and hip. Hold for a moment, then slowly lower the leg back down. Repeat 5 times on each side to start. These gentle movements help strengthen the muscles that stabilize your pelvis, which can improve your overall posture and reduce the factors that contribute to nerve compression. They're safe for most people, but if you have balance concerns, always keep that chair or wall nearby. If you have hip or knee replacements, ask your doctor or physical therapist if these movements are appropriate for you. Remember, the goal isn't to push through pain or exhaust yourself. It's about consistent, gentle activation of supportive muscles. Even a few minutes a day can make a difference over time. Be patient and kind with yourself as you build this into your routine. Before we wrap up our main approaches, I want to address some common mistakes and myths that might actually be making your symptoms worse. The first mistake I see is people thinking they need complete rest to recover. While it's true that you don't want to aggravate the area with intense activity, completely avoiding movement often backfires. Prolonged inactivity can lead to more muscle tightness, more stiffness, and potentially more compression on the nerve. Gentle movement, as we've discussed today, is usually better than no movement at all. The second mistake is ignoring the role of everyday habits. Many people focus only on doing specific stretches or exercises, but then they go right back to sitting in the same tight pants, in the same sinking couch for hours on end. The stretches help, but they can only do so much if the underlying factors contributing to compression are still present. Think of it as filling a bucket with a hole in the bottom. You have to address the hole, not just keep adding water. A common myth is that this kind of thigh discomfort means something is seriously wrong with your spine or hips. While spinal or hip issues certainly can cause referred pain to the thigh, the specific pattern of burning, tingling, or numbness on the front or outer thigh is often related to the nerve we've been discussing, and it's frequently a result of compression from soft tissue and positioning rather than structural damage. That said, this is exactly why it's important to see a doctor for proper evaluation, especially if your symptoms are new, severe, or changing. Another myth is that you just have to live with it because it's a normal part of aging. While it's true that certain changes make this issue more common as we age, that doesn't mean you can't take steps to reduce the discomfort. Many people experience significant improvement with the gentle approaches we've discussed. It's not inevitable that you must suffer with this indefinitely. There are things you can do. Finally, some people think that if a little stretching is good, a lot must be better. But overstretching or pushing too hard can actually irritate tissues and make symptoms worse. More is not always better. Gentle, consistent effort is the key. Listen to your body and respect its limits. Now, while these gentle home approaches help many people, please see your doctor right away if you experience any of the following. If you have sudden, severe weakness in your leg that makes it difficult to walk, that needs immediate medical attention. If you notice numbness or tingling that spreads to both legs or affects your bladder or bowel function, this could indicate a more serious issue and warrants urgent evaluation. If the burning or pain is severe and not relieved by rest or position changes, a healthcare provider needs to take a look. If you have unexplained weight loss along with your symptoms, this should be investigated. If the discomfort started after a fall, injury, or accident, you should be examined. If your symptoms are getting progressively worse despite trying conservative measures, it's time to seek professional guidance. Trust your instincts. If something doesn't feel right, it's always better to get it checked out. Your doctor can perform a proper examination, possibly order imaging if needed, and rule out any conditions that might require different treatment. The approaches I've shared today are meant to complement, not replace, professional medical care. Let's quickly recap what we covered today. First, we talked about gentle hip flexor stretching to help create more space in the area where the nerve travels. Second, we explored side-lying stretches to release tension in the outer hip and thigh muscles. Third, we discussed practical adjustments to how you sit, including taking regular breaks, using firmer seating, loosening tight waistbands, and being mindful of leg crossing. Fourth, we covered gentle strengthening exercises like bridges and standing hip extensions to support better pelvic alignment over time. And we addressed common mistakes and myths, including the importance of staying gently active rather than completely resting, and why more stretching isn't always better. Remember, you don't have to do everything at once. Start with one small change that feels manageable and build from there. Maybe it's trying the hip flexor stretch once a day this week. Maybe it's loosening your belt. Maybe it's just standing up for a minute every time you've been sitting for half an hour. Small steps add up over time. Be patient and kind with yourself. Progress looks different for everyone, and your body will respond at its own pace. If you found this helpful, I'd be so grateful if you'd give this video a thumbs up. It helps other seniors find this information too, and it lets me know that this kind of content is useful for you. And if you're not subscribed yet, consider joining our community. I share new videos every week to help you stay strong, healthy, and independent as you age. There's a whole library of gentle routines and practical tips waiting for you. If you'd like to keep going, I recommend watching my video on gentle hip mobility exercises for seniors. It builds nicely on what we covered today and gives you even more tools for keeping your hips happy and healthy. I'll put the link on screen and in the description so you can find it easily. Thank you so much for spending this time with me today. I truly appreciate you being here, and I hope these gentle approaches bring you some relief and comfort. Take care of yourself, and I'll see you in the next video.